Great. So we are live on everything actually. So let me see also on Instagram. Yeah. Okay. Fantastic. So thank you so much. So how do I pronounce your name? Dr. Lavan, right?
Yeah, it's perfect.
Okay. I'm pretty sure you know the name of, you know the meaning of your name.
Yeah, well, I know it's Rama's son, but I also, my mother tells me it means gorgeous, so I go with that.
Yeah, that's the best. Okay. Thank you so much. Okay. It is saying, I'm just gonna try to reconnect Instagram. We are live on LinkedIn and also Facebook, so feel free to say hello to anybody who's following you right now. But I'm just gonna try to reconnect to Instagram again.
Please. No, I'm looking forward to catching up today. Where are you calling from today?
Well, I'm based in Essex, otherwise live in Essex, but clinic is in Harley Street, so
Yeah.
yeah, that's where I go for therapies
Ah,
or to see
good.
patients. And you
Yeah,
are also on Harley Street?
yeah, I'm number 10. So my main NHS work is South London, Sutton and Croydon. But my Harley Street doing, I do kind of once every 2 weeks. I used to do weekly, but a lot of some of my ADHD work I do virtually now, and it's only face-to-face patients, which is probably only once every 2 weeks I need to go up, which is quite helpful.
Yeah, so number 10 shouldn't be that far from us because
Yeah.
I'm in number 2.
Oh, really? Okay. So we must be there. Yeah, not far at all then.
Yeah, yeah. So where is your other practice otherwise?
So yeah, my NHS practice are South London. So my national health work is in two practices in South London.
Yeah,
Southwest London, so kind of near Kingston, Epsom, Richmond, that kind of area. But yeah, the private is only, I guess, what would I do? Yeah, online twice a week, I say, for the
yeah,
ADHD. And then once every 2 weeks for the other stuff for Harley, general practice stuff.
yeah, yeah. I'm interested to, hear about ADHD and also diabetes as well. Okay, on my side, I can't see the top of your head. I don't
Oh
know
yeah.
what.
Oh
I'm gonna also keep checking, so I'm not distracted. I'm listening to you, but I'm just gonna check also on the whether people can see, as your mother
no,
say,
yeah,
gorgeous.
no.
Okay, so I'm interested to talk about, uh, of course, ADHD, as we know we see more of,
Yep.
and of course diabetes is rampant.
Yes.
And then I want to talk more about that in terms of what are you offering, because I don't go to doctors, normal ones, so I don't know what they are doing with the patients. I
Yeah.
see the other end where the patients come and I am then dealing with them in terms of
Yeah.
natural medicine.
Correct.
But I would love to know from you,
Yeah.
um, and also I want to know the difference between NHS, a mainstream approach, and then private, GP. How does that work? I've never
Sure.
seen a private GP separately.
Yeah.
So yeah, please tell me.
Yeah. So to be honest with you, in terms of when it comes to ADHD and diabetes, you can imagine now we are trying to move away from this kind of obsession around medication. We appreciate, yes, medication, scientifically driven. And I always feel when it comes to medication, and I do, talks for even drug companies, and I'm happy to support them, but I always say I don't want that to be the number one first thing to do. When
Yeah,
someone is diagnosed with diabetes, when someone is diagnosed with ADHD, what are the practical things we can do? What are the natural things we can do first? And I
yeah,
know, some of our medical school teaching forces us in a way to say, oh, you're recently diagnosed diabetes, here's medication day one and crack on. I really hold fire on that. I
yeah,
know some of my colleagues would say, oh, but, love, and every time you leave it a month or 2 or 3, damage is happening with sugar. Yes, I do appreciate that. But, I'm 41. If someone came to me, a doctor, and said, love, and you're diabetic today, I would at least want the opportunity to start paying for a gym, going regularly, focus on my health, drinking
yeah,
good water, all the basic, sleeping well. I mean, how many times do we in this country, we walk around with a badge of honor saying, oh, we haven't slept because we're working hard? That's bad, isn't it?
yeah, yeah. Insomnia is huge, and we know how insomnia or not sleeping well. I mean, I can't imagine not sleeping well because I sleep really well. But I know it's almost at an epidemic level where people don't sleep very well. And also, what I find with people and patients is that some people's level of health is very low. They
Yeah,
because they have never been as healthy, so they think if they can have interrupted sleep, little bit of sleep,
correct.
5 6 hours, that is enough for them, which is not the case. You should have deeper sleep, and
Correct.
how you feel next day, it is
Yeah.
important to. So it is also about showing people that what being well actually means.
Correct, correct. And you make a good point. The sleep, it is very good. You pointed out deep sleep. It's all well and good sleeping 10, 12 hours, but if you're not in dream sleep or deep sleep, there's no point. It's not restorative. You're going to increase your risk of dementia, cardiovascular disease, and even
Yeah,
some of the good drug companies, they'll be very honest and they'll say, and some of the talks I do now, we focus on sleep at the start. We say if you're not sleeping, it increases your risk of diabetes. So
yeah,
this idea when patients come to us and say, "Oh, Dr. Loven, I'm now diabetic," I first, it is worth making that effort to just see what are they doing with sleep, what are they doing with exercise, are they fitting in meals, are they doing intermittent fasting or good things like that? Because I'm sure you'll see a lot with, when it comes to intermittent fasting, a very good natural. I'm full support of intermittent fasting. I fast 24 hours once a week, so just pure water and things. I do that every week. But
yeah,
with intermittent fasting, a big mistake people make is what a lovely thing to do. But then their first meal is a massive, massive meal, processed food,
yeah,
all the other rubbish.
yeah,
You
yeah,
should never, never do that because actually you will release insulin very quickly on that first meal and you are actually increasing your risk of diabetes. So, what I tell people is actually when they do the intermittent fasting, when you do break your fast, start with something slow, maybe some vegetables, maybe some nuts, ease
yeah,
the insulin release. But yeah, like you said, I think we need to focus just before we start throwing. There are some cases, of course, life-threatening and very high sugars. Of course, I accept
yeah,
that.
yeah.
That's different. But your day-to-day, someone who's got a little bit of diabetes, why don't we all just give people a chance, give them the education, let them take a bit of ownership through natural therapies to then try and bring it down?
Yes, I mean, yeah, and again, you make good points. It's really good in terms of what you're saying, but how much it is actually implemented at the kind of at the level of NHS, I know that most doctors don't think like that, and I'm very pleasantly surprised that you are saying like that, and you look like that as well. Because I've seen doctors who themselves are not healthy, and they drink and they smoke, and they are not
Yeah,
fit, to talk about health issues. But
yeah,
this is the awareness that I educate about. Like you said, you are doing talks. I do so much stuff on social media, online, as well as through my education with my patients, where
good.
people are like, why doctor has never mentioned it. But I also feel that sometimes doctors do mention it, but patients don't listen,
Yeah, yeah,
because people are also into this pill culture, which I find just really damaging. Okay, give me a pill. And
yes,
I keep talking about there is no pill for health. You
no,
need to look at everything and then
correct.
start with that. And still you can use, I mean, I'm not against modern medication. I am more in favor of integrated medicine, because
Yeah,
modern medicine has got great use. It's in case of emergency, it's for acute situations. You can use it really, really well.
yeah,
And with that, I find if you then use natural medicine, it can work so well,
correct,
together. But
correct.
because doctors, and I mean medical doctors generally are
Yeah,
not trained that way, they don't
yeah,
think that
yeah.
that can make a difference.
Yeah, and I think we need, and you make a good point with this point about just giving a pill for anything. I mean, we still in my day to day, I still have patients coming in with chest infections regularly, and they're smokers, and I'm not harsh about it. But why? I'm just going to throw a further antibiotic at you, ruin your gut health, make you depressed eventually because these antibiotics they have damage there.
Yeah,
Resist build up resistance. And all it is if you just stop smoking because you're 34-year-old, that may reduce your risk of infections. And you also said the point about, they come in and we give a pill. And you're right, sadly, and this is just to touch on a slight mention about the private and the NHS. In
yeah,
an NHS practice, you can imagine, Dr. Paul, that people come in, I'm depressed or I've got chest infection. And sadly, because of our limited resource, that 10-minute rule or whatever, we
Yeah.
quickly listen, oh, yeah, it's a bit of infection here, or I'm depressed, I want to kill my, okay, here, antidepressant, because it's 10 minutes or 15 minutes or 20.
Yeah.
Actually, privately, not that I encourage everyone to go private because I feel sorry for people, but
Yeah.
at least in the private world, we have an hour, 2 hours, half an hour. You then go into, why are you depressed? Oh, you're eating things that, well, why don't you stop eating this kind of food? Because that can actually encourage depression. What's the social situation? Oh, I'm late. Well, why don't you fit in a bit of exercise? I don't have time, doctor. Well, did you know that high intensity training, HIIT training, you do 10 minutes of that and it lasts 4 days. The effect lasts 4 days. You know, these simple things that unfortunately we're rushed in the NHS, and therefore this is where private sadly does come in. I do wish there was a world where NHS could provide that 15, 20-minute, half an hour. But because we don't have that, people like yourself, it's wonderful that we have that avenue that you can actually feed in and actually help support the patients.
Yeah, yeah, absolutely. I mean, I take an hour, and even
Oh,
that I have cut down from 2 hours. Sometimes it used to be so long, and I thought,
wow.
no, no, I'm not making sense because it's just too long. But I really feel, and I do have doctor friends as well, who feel that 10 minutes is not enough, but they're just also bound by the system. The system is such that otherwise you'll have line of patients outside, and then you have your own, what is it, agendas and
Yeah,
guidelines and everything, so you have to fit into that. So I do feel that. I sometimes feel actually sorry for NHS doctors, because I feel they're so bound by so many regulations
yeah,
that
yeah.
it's like, because this is the thing that I've heard from police inspectors, and I've had few patients who were police inspectors, and they said, we went into policing to help people, but we find that we are so bound by litigation and legal stuff that that's
Correct,
the least that I'm able to do, is help people. So same,
correct.
I guess, is happening with, I became a doctor to help people, not
Yeah,
not
yeah,
to give them more time. And but
correct.
what would you suggest? Do you suggest anything when you have, I don't know, meetings with like higher authorities? Do you
Yeah,
suggest to them that
yeah,
how can we add in, for example, my example would be that every GP practice should have a holistic practitioner of some
correct.
kind with it.
Yeah,
Yeah.
yeah,
Who can give more time? If GPs
correct.
can't give more time, fine.
Yeah,
But then we have another practitioner who can give even 15 minutes of talking about
correct.
diet.
Yeah, no, you're spot on. And to be honest, in the last since 2020, small changes have occurred. And this is not in a holistic way, but it's a thinking outside the box way. So general practice in GP world, out of 100, say you've got 100 patients, about 20 to 30 of those patients will be non-medical. What I mean by that is they have a social issue. Their housing is a problem, their
Yeah.
finance is a problem, their job is a problem. So thankfully in 2020, this development of what we call social prescribers or link workers came in. What that means is as they came in, they'd say, doctor, I'm feeling low, I'm feeling this, or and then when you really go down and listen, it's actually because they've got a situation, they've got a fungus thing on their wall, they're
Yeah.
struggling to breathe. You fix that, they won't come and see you. So slowly, slowly, we started pushing that aside. But I agree, even with what's remaining, a small portion of that as well, definitely do need to see the holistic practitioner, because a lot of it is around diet, a lot of it is around exercise, a lot of it is around just general kind of waking up. Do you drink water first thing in the morning? No. And then what time do you drink water? Well, about 3 o'clock in the afternoon. Well, of course, that's not good. That's not good for kidneys. So you are already putting yourself at risk. Did you
Yeah.
do any form of exercise? No, I started working from home at 8 o'clock. I haven't got up until 7. Did you get up for a break even? No, no, I didn't even get. You sat in one place. How's that good for posture? How's that good for mind? How's it? You didn't even go outside to get oxygen. All these basic things that even I have to be honest, I'm preaching now. I was similar to this 10 years ago. But
Yeah.
now I guess after I turned 40, I realized how easy, if you get just the sleep, eating and exercise at reasonable,
Yeah.
I already feel better in myself every morning. You of course everyone has bad days. Don't get me wrong. I don't walk around every day going, yes, I'm the best thing in the world. But I just by even January 1st, just by fasting once a week, intermittent fasting, eating less processed food, less sugar, cutting down alcohol, in fact stopping all of January, all of these basic things. And,
Yeah.
alcohol people associate, oh, Western culture and all that. I have some of my Caucasian colleagues upstairs, my practice manager, my doctors, they're of white origin. They stopped drinking for the 1 month. They go, Lovin, best thing I ever did. I have now an app. Very occasionally, when I'm in a group and it's a nice party, yes, of course, they enjoy it. But they don't now drink. And, all these simple things that I think we are not passing through public health or through this country. We're not passing information.
No, no. I mean, this is so wonderful. I'm glad we are having a conversation, and but it's good to know that there is some movement about it. But I just feel some of the things we do very slowly, and through the systems, and it's about every system is like that. NHS is no different. It's a system. It's an organization. So certain things are very slow through it.
Yeah,
And with private also, I just feel that people have the mindset, private is not necessarily that expensive. If you can smoke and, and drink, save that
absolutely.
cash and actually go and see a GP privately,
Absolutely.
um, and do something from that. But it's the mindset. What I
Yes.
find it has shifted definitely from originally when I started practicing years ago, is
Mm.
that people would, one, they wouldn't even have a clue that a herbalist or somebody like me actually exists who can
Yeah.
help them.
Yeah.
And secondly, they would not know, it wouldn't even occur to them that, okay, I can actually save some cash over a few
Yeah.
weeks and
Yeah.
then go and see someone privately, because that's going to help me long term.
Correct.
So
Legacy.
it's also a mindset issue as well, that how do we encourage people to take health, in their charge, and not just only rely on NHS. I think NHS is brilliant. It's a great concept. I've had only a couple of interventions in the past.
Yeah.
I was hospitalized for ectopic pregnancy, and it was great stay.
Yeah.
I
Yeah.
looked on time, everything was just perfect, and no cost. I mean, cost of gynae operations is so high, you're looking at
Yeah.
thousands of pounds if you have to actually go for ectopic operation or anything privately, right?
Yeah.
It needs a little bit of modernization towards integrated
Correct.
medicine, where we add people like me. I would
Yeah.
love to be on the NHS, you
Yeah.
know and work more with patients.
Correct.
So yeah, yeah,
I think it will come. I think at the moment it's just more knowledge we're gaining. I mean, even now people are talking a lot about this gut health. How we can improve what we're eating. This sauerkraut or kefir or kimchi. People are getting quite interested. Oh, that can help. Yeah, it can help because we know that about 90%, 90 to 95% of our serotonin, our happy chemical, is made in the gut. So doesn't that logically make sense that if our gut is happy, we're going to be happy? But
yeah,
the obsession now, sertraline, one of the medications we give in general practice, one of the highest prescribed medications, because the resilience, after COVID, we are getting 20-year-olds, 30-year-olds calling me, Dr. Love, and I'm depressed, I'm feeling low, there's no resilience building, and what they feel is, oh, I'll just pop a pill if I take a daily pill because my friend takes it. And
yeah,
what I'm sad about is we're not having the time to teach this culture that, no, just can I just look at your lifestyle, just spend that time. But where can respectfully from my side as an NHS doctor, when we this morning I was on call today, so we had 540 requests come through to see us, 540 in the morning. So you're trying to clear that through. Some of them are, useless. Some are like, I have literally fungus on my wall. Can you help? I can't help as a doctor for your wall. One
you get
person
that
wanted,
phone
yeah,
as
people call. One person wanted paper, A4 piece of paper. Why are you calling it? So there's an abuse element as well. But if
yeah,
you
yeah,
got rid of that, if you then put the link worker and deal with the social issues, then leave the kind of cancers, significant high blood pressures that are having headaches and need acute attention. What a
yeah.
lovely place where if 10 to 12 patients could see someone like you sitting in the room next to me, and then we discuss together, Love, and I have done this, I have done that. I have a feeling this will improve. However, I still think they may need medication maybe in 3 6 months'
Of
time.
course, yeah,
Let's collaborate. And that's how we have to do it. But we have lovely patients who are already ahead of the game, who probably speak to people like you and said, Love, I've done all of this, I've improved it, but that cholesterol is still a bit of a struggle. I
yeah,
heard that this statin is helpful. Let me run through the risks. And maybe they do benefit from a statin. The data suggests that can be helpful. Don't get me wrong. And this
yeah,
is
yeah.
where you mentioned earlier, if we can join rather than just saying, oh, just Dr. Paul or just Dr. Mix it up and do it would be lovely.
No, I mean, as I said, I'm not anti against anything, because we are trying to improve patients' health and our health as well. But it
Correct.
is about knowing when to use what and how to use it, and not just to rely on medications of any kind. I don't like to rely even on herbal medicines.
Yeah.
I give very minimal medicine when it comes to
Good.
patients, but I do a lot of work with fertility where time is very tight, and we are trying to do so much with their health. That is the only time where I give very intense dose of medication for 3 months, which is all
Okay.
natural herbal medicines.
Great.
Um, I don't give that kind of high dosage after 3 months, because
Sure.
we are doing more of a rejuvenation, and it can only be done for
Good.
3 months, so shorter time.
Good. Good.
But it is knowing when to use a statin and
Yes.
use it really well with your health, and then it
Correct.
can even work so much faster and better for you.
Correct.
Like,
Correct.
so, okay, so tell me, have you heard of Ayurvedic medicine?
Yes, I do. Yeah. So I don't know if this counts, but I mean, I drink from a copper cup every morning. I don't know if that's part of it, but I know when I went to Kerala, massage and oils and things. But yeah, as in my background is my parents are from Sri Lanka, so their origins are South Indian. So we do
Right.
know about it. I know relatives of mine in Sri Lanka have been in the Ayurvedic world. Probably why I'm a lot more open. So I've learned a lot over the years. Where even first thing in the morning, my water has certain things, cinnamon, and I put it like a whole combination ginger. I make it every morning without fail. So I'm very much more open just because I've had exposure where I don't understand why when my relatives in Sri Lanka, India were fit and healthy, but as soon as they came over here, everything went wrong. Diabetes increased, heart attacks occurred, cancers. I have cancer. I have family in the cancers at 29, 30, 40.
Yeah.
Terrible. And it doesn't make any logical sense for me why this was never heard of there. I know we're picking things up early. I accept that. But these are young people getting cancers, young people getting heart attacks, and something is missing. And I do wonder, lifestyle wise, nutrition, stuff we're eating, herbs, all of this, should we be a bit more open to just
Yeah.
at least try and fit that into schedules?
Yeah. Yeah. But one of the things that I keep hearing from yeah, from people, and more also from medical doctors, I
Mm.
think research scientists are probably more open to it and becoming even more open. But it is more, GPs is probably sorry, one of the worst
No, no,
one.
no. It's
It's like there is no evidence for natural medicine. That's one of the things that I come across so many times. Now I'm just, anybody who says that, I'm not
yeah.
interested to have any conversation with them, because
You
we
can't.
have data and data and data, so much data
Yeah.
available on herbs, on natural
Yeah.
medicines, on
Yeah.
natural therapies.
Yeah.
Ayurvedic medicine has been used for 10,000 years, because it has started when the agriculture started. It started with that. So
Yeah.
we have that, and we have Ayurvedic medicines used at least for good 5,000 years, very
Right.
properly as a medicinal system. So we
Yeah.
have empirical data, which is hundreds and thousands or
Yeah.
millions of cases. So we
Yeah.
can't say we don't have the data. But that's
Right.
one of the things that I keep hearing about. We don't have the data. We don't know how natural medicine works.
Yeah, yeah, and this will always be a battle, unfortunately, because everyone goes on this kind of evidence-based thing, which I accept. Yes, evidence-based is good. It can be helpful. They do trials where they've got two wings and all of that. But
Yeah,
from my side is when you think about the patient, how are you going to improve the quality of life of that patient? And if you see over and over again, when we see patients, they say, Doctor, I hope you don't mind. And I feel bad when they say that because they're worried that I'm going to challenge them and say, why are you taking these herbal? But they say, I've
yeah,
tried this. What a lovely thing to hear. I've tried something. I haven't think, or this is working for me. My blood pressure has dropped since trying. Oh, that's very interesting. Why would I would like to learn from you, and if that can be applied in some other situation, how wonderful can it be? And I
yeah,
do think this whole gut world thing, I know people are, yeah, do we believe in this, do we not? If you look at things like aspirin, for example, lisinopril, some of the medications used actually started when they made it was actually based on herbs. People
right.
can talk about all the things they want, but some of the heart statins, they're actually from a herb basis. This Ozempic, this weight losing medication that people are always banging on about, you can talk about it, but it's actually based on a venom from an animal. Like all these things are not
Yeah,
just peeled out and things. So I think that's one. And the second thing is you now, I mean, I'm going to a conference in America around gut health, about ADHD, mental health, how we can improve it without the need of medications. And in
Yeah.
fact, the people that are part of this is the Cleveland Clinic. These are a high, as they say, very intelligent, clever doctors from Stanford, from Harvard, and they are turning around where when doctors struggle to get things fixed, they don't go medicational, they go to these guys to help. And
Yes.
further to that, the last point, and I will say quite after that, is we're just because we're going to be touching on ADHD. The work I do, it's all good that I try the medicational stuff, I try the lifestyle stuff, but if I don't win, I actually go to a clinic called the Key Clinic in London, which is
Mm.
all around this. They talk in a more holistic approach, and they look at things like copper. They look at things like iron. They look at things like vitamin D, all of these things that are there. And why is it the combination or the ratios that are causing the ADHD to get worse? So I think, sometimes it may be that it'd be lovely if they came to you first. But even if they didn't, I have a feeling when the really difficult cases occur and they are not
Yeah.
successful, they may come back in for help in this way, natural.
Yeah. Yeah. I totally agree. I mean, because we see patients who have gone everywhere around, then they come to natural medicine, nothing else is happening, and now let's do therapy just to help ourselves relax, and ayurvedic medicine or therapies are not just for relaxation. There is more therapeutic uses for it.
Yeah.
But at least they're starting from that point.
Yeah.
And it is also about the energy connection between practitioner and patient, which is equally important for their healing. And I
Correct.
find that is the most important part of healing, because healing only happens when patient can trust you. When you
Correct.
trust someone, and if that person then knows how to use that, for your benefit, for patient's benefit, it can then help them to either also to take action. When people trust
Correct.
you, like you, they will listen to your advice, as
100%.
practical as that. So that's what I find. And in my practice, I love doing therapy work. Right now I do all the therapies myself.
Wow.
But that is the time when I know all the secrets of the patient, because they have time. They're
Yeah.
lying on the couch, and then
Yeah.
I also have time. We are chatting a little bit, and they
Good.
tell certain other things. And that's when they can actually relax without anybody asking them to relax.
100%.
Because relaxation doesn't happen, especially if somebody asks you to relax, you feel like
Yeah.
punching their face, because you
Yeah.
can't relax like that.
No. No.
But when you're doing therapies, and even for diabetes,
Yeah.
diabetes is also exaggerated by, for example, stress. And now,
Correct.
how do you manage stress? That is the biggest thing that we should teach people, how to manage stress. Stress is
100%.
not per se stressful, it's how you perceiving the stress, how you taking that,
Correct.
and making yourself mental with this stress is what we need to do. And
Yeah.
therapies, I love doing therapies, because I find that is the most healing time that
Yeah.
patients have. And most of us are busy, especially professionals like us who don't have that kind of time to lie down and have a therapy session. But I
Correct.
find if we can incorporate that side of therapy into healing model of, where you have the modern medicine, where you have
Yeah.
any other operation you need to do, then you rely on doing therapy work, can work so well. And it does work so well, as you are saying. And I've seen this working where patients are taking modern medicine, and then they are under my care, and all the markers have started to reduce, all the
Correct.
inflammation markers, the diabetes and everything. I mean, I'm right now working with a couple where gentleman has got diabetes, and he also has a
Yeah.
stent, so he is on
Oh, wow.
cholesterol medication and everything. But even within the therapies, he's feeling better. This has been 4 weeks or so, 4 5 weeks, and then
Wow.
they check his diabetes, which has started to come down. I mean, the markers. I'm talking very layman's language here, but his
Yeah.
markers have started to come down. It's only been a month or so.
Wow.
And other thing that I find is, some of the things that we use, for example, this gentleman, he is
Yeah.
constipated. Now, I
Yeah.
know that constipation is a side effect of the medication that he is on. Yeah.
Yeah.
So he is taking Senna and something else for his constipation for about a year. And
Sure.
we know that Senna or anything, any even herbal thing that we take for long enough, your rectum then does not respond to usual reflexes, because he'll
Correct.
get so used to the medication. So we are
Correct.
working with his constipation, and I said, so I'm giving him herbs, and I can already see, even
Hmm.
see simple changes that we are making, breathing exercises that, because I use all these natural ways. There are
Right.
herbal medicines, there are therapies, there is
Yeah.
exercise, there is
Yeah.
yoga, there is breathing. Breath work is very, very important part of my work because breathing
Good.
is medicine. So, do you
100%.
recommend breath work to your patients?
Yeah, I do, and you won't believe. I mean, I listen to a lot of podcasts, obviously, so you may know there's a chap called Stephen Bartlett. It's all about business, but actually, he's gone very health orientated.
Yeah.
Top podcast in the country. Now, what I admire about him, his wife is a breathing practitioner, which helps, I guess. But every guest he brings on who is, doing very well in their life, teaching about health and how we can improve and how we can maximize, the first thing they talk about is breathing, how to breathe, Hof technique, if you're in the car, if you're anxious. So definitely, I 100% support that. And I do mention it. A lot of the time, patients, because they can't see it, they say, oh, how's breathing going to... Well, if you're not breathing right, how can everything else fall into place? If the amount of oxygen, the absorption... And I think it's this point, trying to get to the first principle of, if the first thing when you wake up is your breath, if you don't get that right, and then next your fluid intake, or if you don't get these basic things right, how we were designed, how can we ever be successful or get through our day without good health?
No, no, agreed. So I want to know a little bit more about the work that you're doing with ADHD and what are your thoughts, especially as we know that it is on the rise. Or do you agree with that or disagree with that? And yeah, or have you seen any? Because I've worked with some younger patients,
Yeah,
14, 15, 16, where I've used natural therapies with ADHD,
yeah,
apraxia, and other
yeah,
conditions, or milestone issues as well.
yeah.
So, how do you work with that?
Yeah. So in terms of answer to the question of is it there? Yes, it's there. Is it being diagnosed more? Yes, definitely, because there's more talk about it. Mental health is being talked about more. ADHD is being talked about more. You think, 20, 30, 40 years ago, there were people with ADHD, but sadly, they were the ones at school who were called the troublemakers. I can already think of two kids in my school. They were, very intelligent children. I know that for a fact, but because of the way the ADHD was, it impacted them. And sadly, they weren't successful in life because these things weren't picked up.
Yeah,
Now it is being picked up more. I think I've had to hand on heart say, I think it's being diagnosed far too much. And I think, professionals aren't doing it properly. When I hear about how the reviews are done, so I work alongside a child consultant. He's an ADHD specialist. He says, Lovin, there are nurses, there are junior doctors, there are pharmacists diagnosing ADHD. I say, Dr. Thurman, he's my colleague. I say, as good as I think I am, I will never diagnose ADHD. I will do the follow up. I will do all I can with the nutrition, the vitamins, changing medication. I'll do all of that. I will never diagnose because you, poor thing, you've studied the 6 years, you've done another 6 years training to become a specialist in ADHD. You know everything about ADHD. How am I to come in there and just say I can diagnose? So I
yeah,
leave it to him. And as a result, we have a good practice because actually they trust him. They know that he's done all the training. And what they like about our practice and why we're doing relatively well is we have that open-minded lifestyle approach. So
mm,
patients, when I introduce myself, I say, I'm not Dr. Thurman, I'm his colleague, we work together, but my job is, as much as I'm here to adjust medication, I want to start bringing in vitamins. I want to start bringing in your sport level, your nutrition, your diet. Because what I find with all our children that we diagnose earlier, the ones that play sport, the ones that are good with nutrition, they come off their medications quicker.
yeah,
Whereas the ones that are not so active, they're the ones I struggle, and I'm still seeing them when they're 30, when they're 40, when they're 50 years old, and they're still giving high dose medication. So
mm,
I always say, if we can intervene for our children, as if I looked at it as if it was my child, if I could tell them, look, you're playing the rugby, please keep the rugby, because we've had 3 rugby players, 16-year-old boys who are
mm,
ADHD, but they are off medication now, just because they're so focused on sport. They wake up, it's all about their breathing, it's all about their nutrition, protein shake, gym work. And we do techniques as well. I add in apps and things, for your organization, which is quite difficult for them. We say, look, do this, speak to a health coach, let them show you how to practically work. But their day to day, they're not on their medications that they used to be. Uh,
nice.
and then and then when it comes to the medication, yes, of course, we can start the medication. Sometimes they're in very difficult situations. They're about to be kicked out of school. They're about to be suspended. One of our lovely stories is there was a poor girl, a 14-year-old. She was sleeping around. She was called a troublemaker. She was failing in class. and everyone knew she was capable. She's now top in her college in Cambridge in medical school, just through the interventions we did, lifestyle and a bit of medication, but now she's off medication. And these are the lovely stories that we want to impact. But as a result, we always try to bring in a lifestyle. So there is actually, if people question about, oh, is there data? Is there data? Well, for omega-3, cod liver oil, there is data to supporting in ADHD. Vitamin D, we know, can help improve mood, can help improve immunity. We know in our countries, is it less because there's enough vitamin D in the world, whereas in this country where 50% of the population are lacking. So I start all patients on vitamin D. I start them on omega-3. I give turmeric. I advise on turmeric. There are cancer doctors, very clever cancer doctors, who
Yeah.
are now saying we should do trials alongside chemotherapy. Now, I'm not saying it will replace chemotherapy,
Yeah, yeah.
but how wonderful that they're being open-minded about turmeric, which we only before used to use for joint pain, for example.
Yes, yes. That's really interesting, and it's heartening to see that people can come off medication for anything like ADHD or any other medication. One of the biggest thing that I find depressing is if doctor has given you a medication and they say you are on it for the rest of your life. That's a depressing scenario. If doctor gives you medication, says okay, 3 to 6 months, then I want you to come off it. I say to my patients, I am giving you therapies, I'm giving you herbal medicines, even if you have to take them for a year because your condition is such, I want you to be off them. I
Yes,
don't want you to keep taking them forever. If
correct.
the scenario is such that you have to take them for longer terms, thankfully, natural medicines don't have side effects. You can take them longer term, year, 2 years. But I would like to be free of even, it's
Correct.
tedious to take medicine. I find it very tedious to keep taking pills or anything else. But it is
100%.
wonderful to see, and I know about turmeric, and we know what happened with turmeric was going to be taken away by the Americans. So India had to get the patent back because they
Yeah.
were going to take our turmeric away. But turmeric is such an amazing, amazing herb that
Mm.
can be used, for
Yeah.
liver conditions. It's traditionally used for cleansing your blood, which happens via your liver cleansing. That's how it is used in all skin conditions in Ayurvedic medicine. So that's
Wow.
how, and even topically as well. For acne and for other conditions, you can use it topically also. It
Wow.
works really well. And then, of course, for cancer-related properties,
Yeah.
again, it is amazing. But it is, what I normally say to like my patients is that or anybody who mentions, somebody was mentioning about ashwagandha yesterday on
Oh,
my
yes.
on
Good.
my lives, and I always ask who
Mm.
prescribed it, and nobody prescribed it, right? Because they're just taking it over the counter. They go to
Correct.
health food shop and just started buying it.
That's
And with
it.
turmeric, because it's such a strong plant, if anybody it's not suitable for, or somebody who's a very hot-bodied person, what we call a pitta person,
All
then it
right.
can cause them nosebleeds. Now, people don't
Really?
know this because it's a heating plant. It's very, very hot herb, like ginger. You eat ginger
Yeah.
and you can feel the heat, right? Same with,
Yeah.
but that's the thing, that if they can use it with
Yeah.
the advice of a practitioner when you are
Yeah.
under supervision,
Yeah.
but I'm so glad to hear these stories where people are, or youngsters are coming off medication.
Yeah.
For ADHD, one of the things that I always think from Ayurvedic point of view,
Yeah.
because we have these personality types in Ayurveda. We have personality types in philosophy, in psychology as well. We have
Yeah.
this Ayurvedic body types, and
Okay.
according to that, anybody who has got very, very active mind has
Right.
a tendency to have more ADHD. And
Yeah.
you may find this with your patients, that
Correct.
anybody who is just very active, they're very inspirational, they can't sit still, they are on from one thing to the other because that
Yeah.
is their nature. They find inspiration like that.
Yeah.
But we need to know how to harness that energy, especially
Correct.
when we're younger, so
Yeah.
that we don't medicalize it so much. Like
Correct.
you were saying, it's over diagnosed as well, and we are giving medications which, uh,
Correct.
we should be giving less medication, I'm trying to
Yeah.
say. But
Yeah.
one of the things we use in Ayurveda, for example, one of the therapies we do for in Ayurveda is, and in Ayurveda we say that your nose is the brain, is the door to your brain, because there is no other way for us to
Yeah.
directly, you know, put anything into our brain because it's a
Correct.
secure vault. But if we put any medication through the nostrils, it goes directly into your bloodstream via
Uh,
the brain. Yeah.
yeah.
So we do this therapy, which is called nasya. Nasya
Right.
means literally means nose. So we put medicated ghee or even
Okay.
plain ghee drops in the nose. And we
Right.
know that brain is full of fat. So it
Yeah.
needs fat for it to do better conduction. Yeah.
Right.
So that's one of the therapies that I have used. And
Yeah.
we use an Ayurvedic medicine for people who have got even kind of bipolar tendency, people who
Yeah.
are up and down, and
Yeah.
mood wise, they are good mood, bad mood, sad mood very, very quickly, and ADHD as well. So this can, you can try this. It's so
Yeah. And they
simple.
do it every day? Do that every morning
Every
or?
day. They will do this every day. So they
Right.
get
Right.
up first thing in the morning. They don't even get up from the bed. So you have the bottle
Hmm.
and you will have to warm it up because ghee gets solidified
Yeah.
in winter. So you just warm it up slightly and you tilt your nose and
Right.
3 drops, or 5 drops, 5 drops. That's it. Then you can get up and do your work. But this
Right.
is something they can use for years because it's so simple to do
Yeah.
and it is so beneficial. We use it also for fertility. We use it also for women who have got amenorrhea, for example, and I've used it
Yeah.
as part of my strategy. But this is something that I'm just mentioning that we do
Yeah.
this Ayurvedic medicine for people
Yeah.
who have got ADHD.
Yeah, and you make a good point. This thing about, they're normally brilliant people. Some of my patients, they are the, the funny ones. They're the clown who, because they're like Will Smith, Jim Carrey, they say they've got ADHD. They're the sports stars that excel. And I know when I went on my training for it, interestingly, when the consultant was asking, oh, we're just going to do a test run. Does anyone want to put their hand up? And so I volunteered. And within 7 minutes, he said, "You have ADHD." So then went through, and yes, a lot of things made sense. But for me, I've never medicated, I never would. But the interesting thing is, I found it like a superpower. I love multitasking. I do 50 million things at once. I think if I didn't do that, I would struggle. And this is why, with medication, I worry that we focus. We give medication. So, all the wonderful millions of things they could do, you suddenly bring it into line. It's like they say you're putting glasses on. It feels like a bit blurred, which I know in some cases is important, don't get me wrong. But
Yeah.
why, if there's someone who's got a talent that could use it to their ability, why are we suppressing it? And sadly, I do find we are having more and more, but there is a theory, and I do believe in this, where in places like America, United States, and England, and the UK, we have been over farming our lands due to profits for many, many years compared to some of our other previous countries. So now the nutrient in the food, in the soil, is poorer. If you compare to, say, Poland and Europe or India, if you compare, it's weaker.
Yeah.
And
Yeah.
unfortunately, that messing up where there's the interactions there and the lack of the nutrients, that then causes a problem later, many generations. So you see in some of my areas of Croydon, where there's poor nutrition,
Yeah.
ADHD per se or hyperactivity is far more. But sadly, that's back to what we started with, the basics of nutrition. If you haven't got good nutrition, of course, everything else is going to start going wrong.
Yeah, yeah. I mean, that is a great point about nutrition. In Ayurveda and in natural medicine, we say everything starts from the gut.
Yeah,
So you clear your gut, you make your gut healthier. And there are so many facets to that because gut health is very extensive. It is one of the largest overall system that we have and
yeah,
it has got so many organs in it, and
correct.
how people can improve their gut health. And gut health is linked to, ADHD is linked to even
Yeah,
autism, and we know that it improves with
correct.
by changing your dietary habits. But
Yeah,
that's the thing, that it is a long term thing. I always say to my patients, and even when I'm doing lives and stuff or interacting, is that your health is a long term spectrum. Your health is also a result of what your parents were doing or
yeah,
what
yeah,
your grandparents were doing,
yeah,
so sadly we inherit that. And
correct.
so make sure that what you are doing, especially I talk about this in terms of fertility sense, because we are talking about the quality of the children, and quality of the children is going to come from the quality of the parents' health
Yeah,
or their eggs and sperms.
yeah,
But gut is so, so crucial in this whole thing, and we don't do enough about gut. I mean, we can take probiotics, prebiotics, we can take kefir, we can take all of this stuff. But
mm,
the thing is, still it is not enough. And
yeah,
what are the natural things that we can do, for example, because probiotics are very expensive as well.
yeah, yeah,
So to keep buying them,
yeah,
what can we do simple things naturally as well, which is
mm,
what I always come back to. Okay, what are the simple things you can do? a spoonful of natural yogurt, keep taking that. That has got enough bacteria to get your gut right, if we are looking at bacteria.
Yeah.
So it's all of that, but I'm so glad you are, well, we have the same, similar kind of mindset, so which is just so wonderful for the patients, because
Yeah.
I always think about patients, if
Yeah.
I'm a patient, I
Yeah.
don't care what doctor gives me, whether
Yeah.
it's placebo, nocebo, anything. I want
Yeah.
to feel healthy. That's
Yeah.
my motive, right?
Yeah. No, I mean, and if I always, I've always practiced as if it was my mum, my dad, my daughter, if that was the patient, what would we do? And that point you said about the relationship, I'm very fortunate. I've been in one of my practices for over 10 years, and Dr. Jeffcott, lovely doctor who gave me the partnership. I always used to see patients would come in and they'd walk out with no green paper, no prescription, and they love him. Oh, Dr. Jeff, the best doctor. I feel great. I had a Dr. Jessica, what happened there? Oh no, I just spoke to them. I just spoke to them, gave them time, and they walked out with no medicine. And now I do practice that. I've got a lady at the moment who I was meant to see at 11 o'clock. She sees me every 2 weeks. The staff say love her, and you can't just keep asking her to come in. I go, look at her history of medication. She was on pregabalin. She was on antidepressant, metazapine. She was on sertraline as well, high doses. Every 2 weeks when I see her, I take a little bit off. Someone started all these weird and wonderful medications. She lost her husband, I accept that. And but she's very proactive. She goes to church, she meets with people, community networking, very, very important for the mind. She
Yeah.
does all this. So why is she on all these medications? So step by step, very slowly, I don't rush it. I bring her into, I go, look, if I can see her every 2 weeks, that costs probably the NHS £65. It costs my time. I don't mind. But if it means in about a year, I've got all those medications off, I'm happy. I've done a service to that person. I've reduced the damage of her gut. I've
Yeah.
improved her health in her mind. So I think with this, sadly, you're right. The NHS, it's not catered for that. And therefore, I don't know, I have to be honest with the funding issues and things. I don't think it will ever be fully catered for in that world. But should we be talking like we are today, be open about it, encourage people, and if not, pay privately. Like, as you said, if it's your health, wouldn't you pay whatever it is, the £50, the £200, like you said, you're paying for Sky, you're paying for new trainers, you're paying for new handbag. You do this one intervention where maybe they meet someone like you, 1 hour, learn all the tricks. What do I do in the morning? How do I breathe in the morning? What do I do for lunch? How much exercise? Do you learn that? Write it down and create a stencil for your life that you are proud of that every morning. And if you miss it, I think this is one point to make clear. Don't be harsh on yourself. Don't be what a lot of people do is, oh, I messed up yesterday. I didn't drink my drink. I didn't breathe properly. Oh,
Yeah.
I give up. No, no, no. You take another 2 days. Go and enjoy, have a party, drink out, be kind to yourself so that the next week on the Monday, you get back right on it again. And if you do that, I think, you can do a lot.
That's wonderful. I always say 80-20 rule, 80% of the time, if you are living healthy. And I always say, I mean, that's my rule for myself. In my house, I can control the environment. When I'm outside the house, I can't control the environment, what food I'm going to get. And if I'm going to get pizza and I'm really hungry, I'm going to eat that pizza at that time, But
Correct.
as long as it is, cheat meal can only be once a week. So if
Correct.
you're doing that, then you will never have issues with your health if you're doing that. It's just the overindulgence of a lot of things. And you're
Correct.
right that when people do come off track, they're like, okay, now I might as well eat other two pizzas as well. It's about how to then say, okay, this is fine. I'm going to enjoy today. I'm at a wedding. I'm at a party. I'm not going to stress myself of choosing the best food, because you're not going to find the best food in a party. But then when you come home,
Yeah.
then go back into your schedule.
Correct.
That's
Correct.
it's wonderful. It is a great discussion. I didn't even realize the time. It is so wonderful. And also, so tell me, about your own health. How do you enjoy your health? What are you doing for your health? You have a
Yeah.
family, you have children.
Yeah, yeah, yeah. So I have two kids, 7-year-old Kylan and 5-year-old Syra, boy and a girl. So I'm very fortunate. I can't, ask for more. They're very healthy. Wife, she works as a doctor as well, very open-minded. So we have a lovely setup. You said about, encouraging the kids, they learn from us. We try to exercise in front of them so that they can see them. So they see us doing gym work. Oh, no, daddy's going to gym. Okay. And they say, can we lift a bar as well? So I try to encourage them into them. We try to eat healthy. My wife is very good. She tries. But yeah, my morning, I mean, I have changed a lot even in the last year and a half. But my morning routine, yeah, through a copper cup, sorry, I'll drink water first thing. And then I'll make like a lemon, lime, ginger, apple cider vinegar, turmeric, saffron, uh, black pepper, Himalayan salt, cinnamon drink I mix every morning. I
Super
drink that.
drink.
Yeah, I drink that every morning without fail. And then I will try to fit in gym exercise twice a week, muscle training to build muscle, not for looking good, but more for we know that muscle training is
Yeah.
important for
Yeah.
bone and health. And then I'll do intermittent fasting most days, and I'll do one 24-hour fast, just water, green tea, and black coffee once a week. And then I'll fit in green tea every day. And then, yeah, once in a while, I've cut down alcohol significantly. Just with social events, it's difficult to get out of it.
Yeah.
And it's nice. I guess sometimes, again, back to this networking, if you're all together, it's nice. You're in a happy place. I think sharing a drink is fine there. But I'm conscious that, when all the hard work you do for gut health, if you drink alcohol, you're almost like wiping it away. So I'm very, much less. And I try to drink, yeah, about a liter or so of water every day. And then, yeah, sleeping wise, I journal a lot. I do a lot of gratitude writing. So, what am I grateful for today? What did I do good? How did I help someone? What can I do better tomorrow? And I teach my kids this. So every night I'll get the kids. I go, what are the three things you're grateful for? And it's so wonderful to hear. They'll say very unusual. Oh, love it, Daddy. We were in London. There was that poor man who was asking for money. I am grateful that we don't have to. And these things I think it's important because sadly, the world is full of difficulties. We know around the world with the wars, we know about finances in our
Yeah.
country. And sometimes things can get bad. And I'm not saying you shouldn't talk about it to people. I know we need to talk, but sometimes you do need to reflect and just be grateful that, yes, maybe my health isn't perfect, but what can I do to improve it? And just by writing it down, I think just saying it isn't enough. When you write it down, you reflect, and you know what? Thank God, yeah, I've got two healthy children. When I hear my partner who was struggling, my work partner, to have a child, and now he has one, thankfully, but that stress, and we cried with him. We were through that journey. And I'm not saying, oh, we're better because we have children, but why should I complain? I should help be there for my friend because I'm so fortunate to have two healthy children. So I think gratitude is an important. So those people, they come in, oh, I'm worried about this, I'm worried about that. As you said perfectly well, stress, I tell everyone, is the number one killer. It increases your risk of cancer, cardiovascular disease, heart stroke.
Yeah.
Remove your stress. Be grateful for what we have. We're in this country. We are earning. Have free NHS healthcare. We have water. We have electricity. Be grateful for where you are, and I guarantee your stress level will drop just reflecting on that.
Absolutely. I can't say anything negative about that. I think all of that is like model routine. And yes, you're right. You have to, children model you and you have to live the way it is. I mean, I can't imagine as a practitioner not to live the way I preach. That will be so sad for me to do that. Same with my children. They see me and the same habits they are requiring, and they're very healthy. I have twins, a boy and a girl,
Wow.
and it is what you put out, what you actually show them by your actions, not just by telling them. So
Correct.
it's wonderful to know that your children are also healthy on that path, and gratitude is something, it is absolutely amazing. It's not that I've ever been a complaining kind of person, but
Mm.
now I'm even more, there is nothing to complain. you know
Yes. Yeah.
I'm not going to complain about anything. It is how can we change this situation. So my mindset is, if somebody says, okay, so I've got this problem, that problem, this and that, and my thing is, what is the solution?
Yeah.
I
Correct.
always ask them, so what is the solution? We know the problem is there. What
Yeah.
is the solution?
Yeah.
Because then it shifts your mindset completely, that, okay, we start looking at all the options that can go right rather than all the options that can go wrong. And
Correct.
it is really is a key, because I've seen literally dead people walking, who were told so many things, and then they
Mm.
got up and they started doing stuff. So I know that power of this is
Yeah.
so strong that we can make ourselves sick or
Yeah.
healthy,
Yeah.
how we live and how we think.
Yeah, yeah, and you're right. It's that perspective, that view. My mother is a negative. My father is more optimistic, and then sometimes, of course, you have to be careful. If you're on a street in the dark, there's no
Yeah.
point being optimistic and running around. I appreciate there's a purpose, but your day to day, just I think now when we hear more about the wars in other countries, complaining about house and food and water, I feel insulted if I were to complain, because I can literally now order a delivery. If I can't afford a delivery, I'll walk to the shop. I can walk, and I think people say, oh, it's not very powerful. Trust me, if you do it every day for a period of time,
Yeah.
your angle changes. And now even what I listen to, I used to listen to LBC, about people angry. I'm shouting at this. That's not good for the morning. Don't start your day social media and this in the
I
morning.
know. We used to have NBC on 24 hours.
Yes. And I know I used to be very frustrated when I come to work. I'm already at this higher stress level. Now, music or listening to the children, or then when you wake up and then, of course, open social media. And while you're at work, you're in that mood. Then, of course, open everything up. But
Yeah.
I think but everything we've spoken about, people would argue, oh, I don't know if it makes a difference. If you just do that only, it guarantees it will make an impact. And when people say, oh, God doesn't do anything for diabetes, all that, trust me, it will, because that stress, as you clearly pointed out, is that removes. Then what we're left with, we do the other things, exercise, diet, nutrition. Then whatever's left, that little strip that may require possibly medication, you give a
Yeah.
tiny, better to give a tiny bit than this massive amount of
Yeah.
pills.
Yeah. Fantastic. I think we are at the end of it. Thank you so much for your time.
No,
I
pleasure.
can talk about medicine whole day, you know, but it's wonderful. We'll do another one, or we will meet in
Oh,
person soon as well.
yeah, definitely.
And thank you for your expertise, time, your thoughts, and it's good to know, because I don't interact with GPs as much. I interact more with natural healthcare professionals a bit
Yeah.
more. So
Oh,
this is great, and yeah, thank you for being here.
oh, lovely to see you, Monday. Yeah, anytime you need me, let me know. But yeah, I look forward to catching up soon.
All right, thank you, Dr.
Take
Lavan.
care.
Thank you so much.
Bye.
Bye. Bye.